Thank you so much for being here today. I
Thank
appreciate
you.
it. And we've actually had a lot of people write in and ask questions about this keratoconus. For example, we have one question from a patient, or from a man that came up on our Facebook account, and he says that he's had keratoconus for about 4 years, and he has the RGP lenses. And he wants to know, what is the most common practice to accurately fit these lenses for a keratoconus patient?
Sure. The most important thing, does he have a name there?
We will try to find him, I think. John Snipes.
Okay. So I know you'll have a lot of other questions, and then Facebook, that's unique too, people writing in from there. But John, the important thing here is to determine the level of keratoconus. Like I say to all patients and surgeons all the time, no keratoconus is the same in different people. So get investigated for that, go through a full diagnostic testing in 3-dimension, find out your level of keratoconus, what's your refractive error, meaning do you have higher astigmatism, do you have higher myopia, meaning nearsightedness. Then look at your treatment modalities, glasses and contacts. RGP lenses basically work on you because they are camouflaging your real shape, which is the cone. But RGP lenses are usually uncomfortable in patients like you, especially when their cone is going on progressing. So once you get that checked, you can pretty much look at whether it's the contact or is it your keratoconus that's progressing. And then look at the treatment options, which today there is a new modality also coming in, which we've just investigated abroad, and we were talking about it at the National Academy in Chicago, called C3R or CXR, which is a collagen cross linking. And that pretty much can stabilize your cone if it's in the earlier stages. Otherwise, you can have Intacs of different levels, single segment, multiple segment, and combinations, and even laser combination that we'll see in the next few patients. The other important resourceful sites, of course, you can go to our website. There is a lot of information on keratoconus, but you can also take advantage of National Keratoconus Foundation, which is based in California. A lot of resources there, and Q&As going on. There's a KC Global, London-based. So all these organizations are there to help you interact with other patients, talk to them, and of course you can call or email us anytime. Be happy to help you.
Now, he said that he's interested in getting Intacs because those lenses are so uncomfortable.
Correct.
And so one of his questions was, if he continues to carry on with this discomfort, what are the repercussions? Because he says in the area where he's living right now, there isn't a Dr. Gulani.
Yes, so the repercussions are, again, like I said, if his cone is progressing and he's wearing the contacts on it, he's kind of affecting it. It might end up with a scar. So he has to be careful. First, make sure the cone is not progressing rapidly. Is it just the contacts that are uncomfortable, or is it the cone that's making the contacts uncomfortable? So that has to be evaluated.
So the most important thing, I guess you're telling him, is make sure to go in and at least get it evaluated so you can figure out where the problem is immediately.
Yes.
And because it could be a bad situation if you continue without.
Absolutely. Make sure there's nothing acute going on, then plan for surgery.
Okay, now we all